A, B, C, D, E. Today, we are talking about these five alphabets for a diabetic. Namaskara, I am Parimala Jaggesh, the founder and director of Alamirak Nutrition. What have alphabets got to do with diabetes? Everything. Yes, some of the most key tests for being a healthy diabetic lies in these first five alphabets. So let's check out what these tests are and let's see how many of these tests do you do. The first test is A1C. Many of us call it as HbA1c. And what is this A1C test? What does it actually tell you? How many times in a year are you supposed to do this? So the answers for this is A1C test is an average of your last 2 to 3 months blood sugar ranges. Now, the key for this test is to keep your numbers as near as 7 as possible. 5.5 is for a normal person, 5.5 to 6, 6.5 is for a pre-diabetic. So, if you are a diabetic but a proud healthy diabetic, you would have to aim to keep your A1Cs as near as 7 as possible. What is the frequency of this test? As I told you, the average is for 2 to 3 months. So, ideally, once every 3 months is perfect for this test. In case you can't, at least twice a year, it's extremely important to keep your sugars under control. Let's go to the second alphabet, B, blood pressure. It's a very commonly known fact. Diabetics tend to have their blood pressures in the higher range. Now, what happens if your blood pressures are in the higher range? That leads to stroke, heart problems. So, how do you ensure that you come out of it? Very simple. If you have a machine at home, do check your blood pressures, or anytime you meet your physician, have a check of your blood pressure. Extremely important to be a healthy diabetic. The third test, C, is for cholesterol. Many a time, diabetics' cholesterol levels shoot up irrespective of having a good diet and a good workout. So it's most essential to have your lipid profiles done, to check your cholesterol levels and consult with your doctor what are the precautionary methods you should take to keep your cholesterols under control. D, dental hygiene. Yes, this is something which a diabetic doesn't think about much, right? Dental hygiene. Yes, I do understand the phobia to go visit a dentist, which is very common in almost everybody. But if your gum health is not good, that leads to so many other complications. It leads to plaque buildup, it leads to heart problems. Yes, there is a great link between the wellness of your gum and the way your heart functions. So please don't forego your dental test. Once in 6 months or at least once a year annually, do meet up with your dentist. And the last test, E, eye exam. Diabetes and eye exam, yes, very, very, very important. The nerves of the eye are so very tiny, and if you have been persistently on high sugars, that would damage your nerve vessels. So, how do you ensure you can protect your eyes? Go meet your ophthalmologist. Once in 6 months would be great, or at least once a year. They would ensure, they would check your eyes, find out the state of your nerves, and that would help you to preserve your eyes for a better way for a longer time. So, simple tests, right? And obviously, we all know we have to take care of our kidneys, we know we have to take care of our foot. With that, the five alphabets A, B, C, D, E is a must for every diabetic. Easy to remember. Do make a note of these tests and check with your physician what is the frequency with which you should go for this test. For more such healthy information, simple, scientific, but extremely important, life-saving information, do check out our YouTube channels. Thank you.